right now, hundreds of Oregon National Guardsmen and women now stationed at dozens of Oregon hospitals to help once again as the surge of COVID patients is underway. More than 900 COVID patients right now in hospital beds in Oregon.
Our Lisa Balick's been checking in with the National Guard about their role in all this. She joins us live now. Lisa?
Yeah, I talked with Guard members today who are in charge of the operation, and they say there are actually hundreds of Guard members who were there in the hospitals in these positions back in the fall when they were first called up. They are back again, as well as new members, especially at a very important time right now in the pandemic when there are a lot of hospital workers who are having to stay home, either sick themselves with Omicron or taking care of family members. Hundreds of Oregon Guard members are back on hospital duty at 40 hospitals around the state. The next 2 weeks are expected to be the peak of virus cases in Oregon. Healthcare leaders tell us hospitalization numbers will peak a couple weeks later in mid-February. Hundreds of the 1,400 Guard members were in the initial force that helped out in the hospitals last fall before they were demobilized earlier this month.
The first phase was 530 service members, and the majority of them volunteered again for the job. The additional 700 service members that would call up are going to be a mix of activations, whether voluntary or involuntary.
They do everything from COVID testing to moving patients, help at front desks, nurses stations, and assist hospital staff in non-clinical roles, work where they do not require medical training. The 1,500 citizen soldiers and airmen and women are among 8,000 members of the Oregon National Guard. Guard members are being called up in most states right now to help out during the pandemic, and it's not just in hospitals. In New Mexico, the governor today asked the National Guard to fill in as substitute teachers in classrooms and in daycare facilities in an effort to keep schools open. Several states have called on the Guard to fill in for school bus drivers during the shortage. In Oregon, the role, though, for now, is helping in the hospitals.
A lot of their own employees are either homesick or dealing with family members that are sick. So I think trying to fill that void with the non-clinical hospital support allows the nurses and the hospital staff to attend to their highest priorities.
Now, I can tell you on a personal note that I have heard from somebody who works in one of the COVID ICU hospitals in the Portland metro area, and she told me that she is just ecstatic that they are coming back. She said their service, their help was invaluable this fall, and when they left, they were pretty upset about it and so glad that these folks are back to help. Back to you.